To end, I will briefly discuss approaches to mast cell and limbic dysregulation treatment. How do we treat this? A multimodal approach is needed, including environmental considerations, diet, supplements, and medications. Limbic dysregulation needs to be addressed when present, often first to make any progress. You have to make sure to work with the patient to remove them from external environmental triggers such as mold, if present. I usually start a few supplements and work with diet. With diet, I usually try and start with a low histamine diet. First, the fermented foods such as bone broth and sauerkraut, and adding a DAO enzyme, which is reasonable. However, this is rarely sufficient. And I also like to emphasize that diet needs to be balanced, but a brain in fight and flight has a very hard time with grade. So I recommend not encouraging black and white thinking and helping people remember really truly that the purpose of eating is nutrition. We actually eat because we need the nutrition in food. And when you eliminate vast numbers of food, it's unlikely that daily nutrient needs will be met. And some of the symptoms you're trying to treat may actually be nutrient deficiencies. I do recommend always testing for nutrient deficiencies in mast cell patients who are down to 3 foods they tolerate. And remember also, you can use food to decrease histamine, and that's a more positive way to approach diet, don't you think? I try including some of these herbs in food and diet plans, and you don't have to just buy supplements. Putting these food recommendations together for me was quite helpful. I started including a lot more arugula and watercress. Arugula sprouts are great. Herbs, I love basil and dill, but there's so many herbs here which can decrease histamine. Holy basil or tulsi is wonderful for anxiety. Fruits, you could even get away with cherries. And herbal teas, mint and ginger are great. So are many of the others. I give this list to my mast cell patients, trying again to point out the foods that will help them decrease histamine. Basic mast cell supplementation is going to be quercetin, 500 to 1500 milligrams, up to twice a day. Luteolin, which is found in parsley and celery, does enter the brain, is very helpful. PEA, 500 milligrams 3 times a day. NAC, the DAO enzyme with meals, which may not work that well for many patients. Vitamin C is very useful. MAG, glycinate, threonate, taurine are often well tolerated. I follow red blood cell levels. Again, this is a general list. There's a number more supplements I'm going to mention in a few moments that can also help. Expect that some of your patients are going to react to every one of these, even while other patients do quite well. So usually a mast cell protocol starts with a histamine 1 and histamine 2 blocker medication, each taken 1 to 3 times a day away from meals. I encourage patients to try several different histamine 1 blockers to find which works best for them. Now, many patients are going to object to the histamine 2 blockers because they don't want something blocking their digestive acid, which is reasonable to a point. But you need to explain that histamine 2 actually works in synergy with the histamine 1 blocker and makes the histamine 1 blocker work much better. Also, it's unclear with severe mast cell if the patient is really digesting much of anything at all. I also encourage taking the histamine 2 at bedtime, which has the least amount of interference with digestion. And many patients will stabilize quite nicely on a few supplements with once daily dosing of a histamine 1 and histamine 2 at bedtime. And others may continue to show great sensitivity, anxiety, and reactivity, especially to foods or substances that are airborne. And for these patients, I usually add ketotifen, starting at 0.5 milligrams 3 times a day and going up as high as 2 milligrams 3 times a day in the most sensitive and anxious. In the US, ketotifen needs to be obtained through a compounding pharmacy. I suggest patients try the eye drops called Zaditor for any ocular-related symptoms, and those are easily available at most drugstores in the sinus and allergy section. I may start adding cromolyn after we've done some diet supplements and have started the H1 and H2 blockers. Be aware, please, that cromolyn can work beautifully or can cause some increased histamine symptoms as the receptors become downregulated. I suggest patients go slowly to avoid the dysregulation. And if patients are really reacting poorly at this point, telling cromolyn causes them to feel suicidal and quercetin causes enormous headaches and such, and the treatment feels stuck, I will recommend strongly limbic brain and body retraining. And I often use neuroquant results to show the patient how inflamed their limbic system is, pointing out that this is a physical brain issue of neuroinflammation, not just psychological. I love low-dose naltrexone. I use it like water in my practice because it's so useful for neuroinflammation or microglia activation, or basically the sea of blue neuroquants. It's also really helpful for pain and autoimmunity, and it's a mast cell stabilizer. My protocol for using low-dose naltrexone to decrease microglial activation is I usually going to start at probably 1.5 milligrams and increase slowly every 2 weeks to 4.5 milligrams. That's 80% of patients. In sensitive patients, I start at 0.25 milligrams and increase to 0.75. And this may be more of the patients with tick-borne infection where it seems activating the brain's macrophages may be causing a herx. So if I suspect tick-borne, I will usually start very low, or if I'm dealing with a patient who reacts to many, many things. I believe low-dose naltrexone should be tried in most mast cell patients. And just remember, combining with lipoic acid, 300 milligrams BID helps neuropathy, including small fiber, which is a very common finding in hypermobility and mast cell. The last 2 years, I've had a striking increase in patients with severe GI symptoms. The pain has been so intense that they all get scoped, both ends. And I instruct them to make sure their CD117 staining was done. The finding, often no gastritis, negative cultures for H. pylori, essentially normal, except for more than 20 mast cells per high power field. Actual ranges I've seen have been from 22 to 47, which might be a mastocytosis patient. It's highly reliable, and I rarely have a negative in my selective patients. It really is a reliable test for mast cell, and it's really worth doing whenever you have the opportunity. I explain the test requirements to the patient and have them ask repeatedly on the day they are scoped that their biopsy samples be stained for CD117 and that we receive the actual count. I've found that the patient is their own best advocate here because sending letters tends to be ignored. This is just a quick reminder that a number of controlled trials actually have shown that famotidine, an H2 blocker, can be quite useful in the treatment of COVID. And I include a number of references at the end of this talk. Bioactive lipids are helpful both for mast cell stabilization as well as neuroinflammation, and I particularly like the combination of PEA with CBD for pain relief. Seems to work very well. Homocysteine is my favorite functional test of methylation status and excess histamine, and it's probably best to use a combination product such as MethylGuard rather than trying to put all of these together in different bottles. And it's really important to increase choline uptake when you're trying to lower histamine. And again, the high histamine implies high homocysteine implies excess histamine, and it will be high in many, but not all, of your mast cell patients. Some additional supplements, and there are really many more than this. The first three, red sage and bacal, are both herbs. Bacal is actually skullcap. Some of my favorites, I think boswellia is my favorite, as probably having the least amount of reactions. NAC is incredibly useful for detox, especially when mold is present. I recommend caution with probiotics because they often backfire in patients with histamine issues in their gut. Lactobacillus rhamnosus is usually safe, as are spore-based. And then we also have the peptides. BPC 157 taken orally is very helpful for the gut and collagen. You can also use it sub-Q for collagen issues, and many patients with hypermobile soft collagen issues respond quite well to BPC 157. Thymosin is an immune modulator and can also be useful in mast cell. And KPV is also a mast cell supplement stabilizer, and some patients also find that that's quite useful. These are some antihistaminergic psych meds. I think it's useful to know these, especially as professionals. Mirtazapine is the most antihistaminergic of antidepressants, and it is absolutely invaluable for managing anxious, underweight patients who are not eating, who have insomnia, and who are in danger sometimes of even being hospitalized by the amount of weight loss they have. I always start, you're going to hear this is quite a, it's a mantra, the lowest dose possible, which for mirtazapine, Remeron is going to be 3.75, and I very rarely go above 15 milligrams. It is very well tolerated by patients with mast cells because it does help with histamine issues. And many people use it at low doses to help with sleep, and it does help the anxiety. It's a good one to know about. And remember, it is an oldie. Not everyone may have heard of it. Seroquel is the second most antihistaminergic, and again, I'm going to use that at about 12.5 to 25 milligrams, at most 50 milligrams. It can be helpful for sleep, but remember, it is an antipsychotic. Nortriptyline is actually a histamine 1, histamine 2, and histamine 3 blocker. I use it at low doses, 10 to 30 milligrams, and this one's really helpful for pain, migraines in particular, and is often, again, quite well received. Clonazepam is a mast cell stabilizer. It can stabilize cortisol-driven destabilization. However, there is risk versus reward, and I don't think I've prescribed a benzo in probably the last 5 years, because a lot of my practice involves getting people off benzodiazepines that other physicians have started, and it's really difficult. I much prefer CBD, which can work very well, is also a mast cell stabilizer, and can work very well for anxiety, especially in sensitive patients who don't need strong doses. There's a large population of patients on 2 to 3 milligrams of clonazepam with very limited ability to go to lower doses and tolerate the destabilization, I think, as anyone treating mast cell patients knows. Fluvoxamine. Fluvoxamine became pretty popular during the pandemic, and it did show some properties that were helpful for COVID. It is a mast cell stabilizer, anti-inflammatory, a sigma-1 agonist, and it does decrease cytokine production. I have a handful of patients whose OCD is incredibly well managed on fluvoxamine, and it makes a very meaningful difference in their life. In addition, And many of these patients I found out somewhat with some serendipity was we did starting it for COVID, and these are the patients who liked it, felt really well on it, and wanted to continue. So every cloud does have its silver lining. Bodywork approaches. There are multiple bodywork modalities which can help restore vagal tone and enhance social engagement, which is the key to healing trauma. So I frequently recommend osteopathic or craniosacral work. For ventricular asymmetry, when I see it, we didn't cover that in the neuroquant, but it is a finding which is consistent with TBIs. It also seems to be very helpful in reducing the toxic load through helping the lymphatics drain. And most people feel vagal tone often for the first time when they start craniosacral. Lymphatic is also one of my favorites. It also, with light touch, seems to really stimulate vagal tone. And again, it's very helpful, again, in opening up this area between the ears, the neck, that just becomes so clogged with lymphatics with both mold and infections, and often needs a little more help than you can get with dry brushing. Trauma, somatic therapy can retrain the full nervous system, and I'm really looking these days, I want full autonomic nervous system retraining, which includes the body, not just brain retraining. I feel that's the way people begin to engage and feel real safety in their bodies, which is essential for getting better. So there are programs which you may find run by sometimes physical therapists or somatic therapists. Some of them are online, which makes it very easy to access, where I will frequently recommend patients again to work with their trauma. And most patients have been very receptive when I reframe, what's been called their psychiatric diagnosis. You're anxious, you're depressed, you're dissociated. If I can reframe their trauma, I often do get a ACE history. And when people find that there's a sympathetic audience just describing the fact that their brain has been trained usually to be in sympathetic hypervigilance, perceiving danger everywhere because of trauma, and that there are methods to begin to engage their body again with their mind, to retrain the body, to release that trauma, and to be able to relax more, and again, use the brakes and use the accelerator rhythmically as needed and effectively. Most people are very willing to do that. And this is where I am finding now some of the greatest advances in patients who've been sick for many years and seem very stuck. The other things, functional neurology does help with TBIs. That's often done by chiropractors who have functional neurology certification. Visual therapy, I mentioned, it's done by optometrists. They're working with functional vision, being able to see side-by-side accommodation convergence issues, which are very common with mold and tick-borne illness. If we do chiropractic, I prefer network with less forceful impact. Neuroplasticity is often really helped by Qigong and Tai Chi, working with symmetry and balance. Yoga can be great, but in hypermobility, people can actually get injured. And so all of these are very helpful and really a very essential part for people learning to find safety, to become socially engaged as they work through their chronic illness. And thank you for listening. Have a great rest of the day.